Start with the pathophysiology. Both primary and secondary gout can be present as the acute gout. This is due to the deposition of the monosodium uric acid in the joints, and now the crystals are phagocytosed by the macrophage and the neutrophils inside the joints. That can really macrophage and the neutrophils inside the joint that can really trigger the inflammatory response that can cause the severe joint pain and the redness of the joint and the swelling of the joint. Most commonly, this occurs in the base of the grade 2, specifically known as the podagra, P-O-D-A-G-R-A, podagra. Also, it may occur in the knee. If the patient If the patient have the multiple attack of the gouty arthritis, then the now acute gout can be progressed to the chronic gout, which is due to the long standing of the uric acid. Hallmark can be the tophi present in the joints. Tophi is the uric acid crystals in the soft tissue or the joints. Example can be the ears, tendons, and the brusa. Usually, this is not painful. Also, long-standing gout can lead to the urate nephropathy, also known as the gout nephropathy. Patient with the high level of the uric acid crystals in the urine can develop the uric acid kidney stones that can lead to the chronic renal failure also. But usually this is seen in the patient that also have the diabetes and the hypertensions. Now let's talk about the diagnosis. We always should start with the good history. Then another thing that we can do can be the blood test for the uric acid. Usually patient have the hyperuricemia. Another can be the arteriocentesis. This is the sampling of the synovial fluid. In the patient with the gout, we normally find the WBC between the 20,000 to the 50,000. Normal is less than 200. When we examine the synovial fluid in the polarized light microscopy, we can visualize the uric acid crystals, that is the monosodium urate. The crystals are negatively birefringent. That means because it is negatively birefringent because it has the two reflections of the polarized light. That means whenever the polarized light is parallelly fall with the crystals, then it will give the yellow color. If the polarized light it will give the yellow color. If the polarized light is the perpendicular with the crystals, now it will give the blue color. That's why it is called as the birefringent. It's called negatively because the index of refractions is negative going from parallel to the perpendicular. Now let's talk about the drugs. Acute attack of the gout can be treated with the NSAIDs and can be given with the glucocorticoids and the colchicines. Colchicine actually inhibit the WBC migrations and the phagocytosis of the monosodium uric acid. But we need to take note that the patient with the multiple recurrent attack of the gout can be placed on the preventive therapy to reduce the uric acid level in the body. We can give them the xanthine oxidase inhibitors. That can be the allopurinol and febuxostat. Another drug that we can give can be the pegloticase, pegloticase, pegloticase. And another drug we can give can be the probenecid. Thank you.